WHO has reported that so far there are over 1 million confirmed cases and close to 70,000 deaths globally as a result of the COVID-19 outbreak. Charles Sagoa Moses, the representative of WHO in Namibia, in an exclusive with Today on One, enlightened the public on the coronavirus pandemic, which is believed to have originated in wildlife and then transmitted to humans.
So when you talk about what the coronavirus, or otherwise called COVID-19, it's a virus that started in Wuhan in China and was reported to WHO on the 31st of December, and it was reported actually in a fish market where animal products were sold, and it was found out that a number of people were having symptoms like pneumonia, started with like a flu, then pneumonia, etc., etc., and within a short time it spread all over. So from that time, so we are talking about literally January, February, March, 3 months, it spread all over the world. And it's a new virus. And so we are learning by the day what exactly it is. But what we believe is that it's likely to have moved from the animal kingdom into human. And coronaviruses, you may have heard about SARS, severe acute respiratory syndrome, MERS also. These are examples of coronavirus which were circulating within animal kingdom and then jumped into human. And so we believe that something similar may have happened. This is under investigation to really point a finger at from what animal exactly it came. So that is under study as we speak.
The WHO representative also urged the nation to take good care of their health and protect others by constantly washing your hands with soap and water or using alcohol-based hand rub, which kills viruses that may be on your hands.
We talk about social distancing, at least 1 meter or more from someone who may be coughing, etc. That's also why we talk about, if you are sneezing or coughing, cough into your elbow rather than into your hand. Because we use the hand for virtually everything. You are touching surfaces, you are everywhere, you are greeting, you are opening doors, whatever, you use your hand. So spare your hand into your elbow. Then we are saying that wash your hand as often as possible, because you are touching places. Since you came, you've touched the door, you've touched the table, you are touched. It's human, natural to do that. So you wash as often as possible with soap and water, running water. The reason why you use the soap is that soap has antiseptic properties, which would then kill the virus. As you use the soap, it kills the virus. Similarly, if you don't have water and soap readily available, then you use alcohol-based sanitizer. And we are saying that the alcohol, there at least must be 70% of alcohol. So, and that also does the same thing, kills the virus as you do that. We are also talking about distancing, so that because the virus, because it's by droplet that is transmitted, it may also fall on surfaces, and so we advise that surfaces are cleaned as often as possible, so that even if you have to touch a surface, the surface will be cleaned. We also advise that when you are sick, you feel unwell, and what will make you feel unwell, You have fever, you have headache, you have cough, and general body pains, like the typical flu symptoms that you have. Report to the health facility. And if you have to go for a meeting or something, do not go. You are better off at home. Don't go to the office. Call your boss and tell your boss that I'm not feeling well, so you're at home. Because it's better for you to be at home to rest than to be with other people where you can easily spread the virus. So this is why we advise that. And again, the social distancing, this is the reason. So once you know how the virus behaves, then you are better able to stop the spread. Yes.
Members of the public who suspect that they have come into contact with a person believed to be infected with the coronavirus or show symptoms of being infected with the virus can call the following 2 emergency numbers free of charge at any time of the day: 911 or 0800 100 100.